Imagine a world without MRI machines, without genetic sequencing, without a scientific understanding of germs. How did humanity survive, let alone thrive, for thousands of years? The common perception of ancient medicine often conjures images of dubious potions, superstitious rituals, and treatments that seem more harmful than helpful. But what if we've been overlooking a profound depth of knowledge? What if, buried beneath the dust of centuries, are medical insights so advanced that they not only alleviated suffering, but in some cases predated modern discoveries by millennia? This is not a story of mere luck or crude trial and error. This is the story of how ancient healers, through brilliant observation and intuition, unlocked secrets of the human body that we are only now fully beginning to appreciate with all our technology. Today, we're journeying back in time to explore how some traditional practices were, in fact, surprisingly advanced. Let's start with one of the most dramatic and tangible examples: brain surgery. The idea of opening a living person's skull thousands of years ago seems like a death sentence. And yet, evidence shows it was not only attempted, but often successful. The procedure is known as trepanation, and it's one of the oldest surgical practices we have record of, dating back an astonishing 7,000 years. Skulls from ancient Peru, Europe, and Africa show clear, precise holes that have been deliberately cut or drilled. But this wasn't random hacking. Analysis of these skulls reveals smooth, healed edges of bone around the openings. This is the smoking gun. It means the individual survived the procedure and their bone began to grow back, a process that takes months, even years. These people lived after having a hole carved into their skulls with primitive stone or bronze tools. Why would they do it? Ancient medical texts, like those from Egypt, suggest they understood that head injuries could cause pressure and swelling inside the skull. They may have used trepanation to relieve that pressure, much like a modern craniotomy. Other theories suggest it was a treatment for severe headaches, seizures, or even mental illness believed to be caused by evil spirits. The true genius, however, lies in the execution. These early surgeons knew exactly where to cut to avoid major blood vessels. They developed techniques to minimize infection, perhaps using natural antiseptics like honey or herbs. They understood anatomy on a practical level that allowed them to perform a life-saving intervention with a success rate that is baffling to modern historians. These weren't barbarians, they were skilled practitioners whose work required a steady hand, immense courage, and a deep, empirical understanding of their craft. Now, travel east to the Indian subcontinent, where a system of medicine known as Ayurveda has been practiced for over 3,000 years. At the heart of Ayurveda is a concept that sounds remarkably contemporary: detoxification. The ancient texts describe a process called panchakarma, a series of therapeutic treatments designed to cleanse the body of accumulated toxins, or ayama. Modern medicine might scoff at the term toxins, but if we reframe it as metabolic waste, inflammatory compounds, and environmental pollutants, the concept suddenly aligns with cutting-edge wellness science. Panchakarma wasn't a quick fix. It was a comprehensive protocol involving specialized diets, herbal medicines, massage, steam baths, and a range of cleansing procedures. What's truly advanced is that Ayurveda viewed health as a balance between the body, mind, and environment. It recognized that disease often begins in the digestive system, an idea that modern science confirms through our understanding of the gut microbiome. Treatments like medicated enemas, basti, were used not just to clear the bowels, but to deliver herbal concoctions that pacify imbalances and restore function to specific tissues. Herbal emetics, vamana, and purgatives, virichana, were carefully administered to reset the digestive fire, or agni. This holistic approach, treating the root cause of illness rather than just the symptoms, is a philosophy that modern functional medicine is desperately trying to reintegrate into healthcare. The ancient sages of India understood that true healing requires a systemic reset, a concept we are only now embracing after a century of reductionist, single-target drug therapies. The Romans are famous for their armies and aqueducts, but their most lasting contribution to human well-being might be their revolutionary approach to public health. While Greek physicians like Galen were theorizing about the four humours, Roman engineers were building the infrastructure for a healthy society on a massive scale. They understood, empirically, that foul smells, stagnant water, and overcrowding led to disease. Their solution was breathtakingly practical and scaled to an entire empire. The Roman aqueducts are marvels of engineering, bringing fresh water from miles away directly into cities, supplying public baths, fountains, and sewers. This constant flow of clean water was a monumental achievement in disease prevention. Then there was the Cloaca Maxima, one of the world's earliest sewer systems, which channeled waste away from populated areas and into the Tiber River. Public baths, while social centers, also promoted hygiene on a scale unseen before. The Romans also established valetudinaria, military hospitals for sick and wounded soldiers, demonstrating an organized system of care. This focus on sanitation and infrastructure created an environment where populations could grow and thrive with less risk of the waterborne plagues that decimated medieval Europe. They didn't have the germ theory of disease, but they correctly identified the environmental conditions that fostered illness. Their public health system was a form of preventative medicine so effective that some of their structures remained in use for centuries after the empire fell. It was a top-down, systematic approach to wellness that rivals many modern public health initiatives. Long before refrigeration and modern preservatives, how did ancient civilizations keep food from spoiling and treat infected wounds? They turned to the pharmacy of nature, and their choices reveal a sophisticated, if instinctual, understanding of antimicrobial science. Take honey, for instance. The ancient Egyptians didn't just value honey as a sweetener, they used it extensively in medical preparations, applying it to wounds and burns. For centuries, this was seen as a folk remedy. But modern research has confirmed that honey, particularly varieties like Manuka, has powerful antibacterial properties. Its high sugar content creates an environment where bacteria cannot thrive, and it contains an enzyme that produces hydrogen peroxide, a known disinfectant. It also creates a protective barrier that keeps wounds moist and clean. The Egyptians were using a scientifically valid, effective wound dressing thousands of years before the discovery of antibiotics. Similarly, consider the use of spices. Why did cuisines in hot climates like India and the Middle East become so heavily spiced with turmeric, garlic, cumin, and cinnamon? One compelling theory is that these spices are natural antimicrobials. They helped inhibit the growth of bacteria in food, especially in the days before reliable cooling. Turmeric, a staple of Ayurvedic medicine, contains curcumin, a compound now celebrated for its potent anti-inflammatory and antioxidant effects. Garlic contains allicin, a powerful antimicrobial agent. The traditional use of these substances in both food and medicine wasn't just about flavor.